It's that itchy feeling on your body. What could it be, especially at night? Itching and causing that discomfort. Well, that's what I'm going to talk about here right now. My name is Daniel Coriolano. I'm a doctor, and I've seen many patients with this complaint, especially children, often elderly people or people who have some kind of mental problem with that intense itching and trying to solve it. Let's talk about what it could be and also about what you can do in a situation like this. It's important to pay attention and differentiate the cause from the consequence, because there are many causes for itching all over your body. For example, allergies. Some people eat certain foods and start to itch all over their body. When they eat that food, they have to be careful about it. Another thing, they buy a new perfume, lotion, deodorant, cream, and then, when they start using it, they start to get that itch. It's something that can happen. Have you ever had an allergy to bathing? I've seen it. When a person took a cold shower, they would get all red from itching, and after a few minutes, when their body warmed up, the itching would disappear. But what I want to talk to you about today is not an allergic itch, because those are actually easy to identify. When you give up that food, that perfume, or anything else that causes direct contact and promotes the allergy, the itching stops. Then you can identify it yourself. But if you came here to YouTube looking for some control over this, it is likely that you have an itch that started recently, that gets worse at night, and is caused by a mite. Yes, a mite called Sarcoptes scabiei. You don't need to know the name, but it is a little bug that lives on the skin. It can be transmitted from person to person, which is the main route of transmission, or also from clothing to person. Although this type of transmission is not so common, because this little bug, when it is outside our skin for some time, on clothing, for example, does not survive. So, although transmission through clothing can occur, it is more common to be transmitted through close contact. This little bug lives on our skin, making tunnels in the scaly part of the skin tissue. The female mites are the ones who dig these tunnels, laying eggs in the tunnels they make in our skin. This causes itching, of course. Imagine the bug getting in and making tunnels that can even be seen with a magnifying glass, especially by a doctor. Then it lays eggs, which stay there for about 35 days, and in 2 weeks, another generation is born. And this cycle continues and can occur in the interdigital regions, wrists, buttocks, etc. At night, when the body is warm, the itching tends to get worse because we are more alert and the body's heat can intensify the itching. In these situations, what should you do? There are some medicinal measures and other general care measures. I will talk about this here so that you have some knowledge, but remember, do not use medications without a prescription from a medical professional who is the professional qualified to prescribe them. Self-medication can have side effects, and it is important to have proper guidance. If you identify that it may be this mite, consult a doctor to confirm the diagnosis and receive the correct prescription. The main treatments include a lotion with 5% permethrin, which should be applied to the entire body and left on for 8 to 12 hours before being removed. This lotion kills the mite and can be repeated after 2 weeks to eliminate possible eggs that hatched after the first treatment. Another possible medication is ivermectin, which should be taken in a specific dose. However, pregnant women and babies should not use these medications. There are other specific ones for these groups. In addition to medications, non-medicinal measures include washing all of the affected person's clothes in warm water, at least 60 degrees Celsius, and leaving them to soak for a while, which kills the mites. If high-temperature washing is not possible, items can be placed in a sealed bag for 2 weeks, which also kills mites. This video is intended to provide health education information to help you take the next steps to benefit yourself. If you enjoy educational medical content, consider subscribing to the channel by clicking the red button below this video. In the description, you will find links to other videos on different topics. You can also use the comment section to interact, ask questions, or suggest topics for future videos. Remember, it is important to also treat people who live with someone who has scabies, as it is a contagious condition. Diagnosis is made through a medical evaluation, which takes into account a physical exam, history of itching, and the presence of skin lesions. If there is intense itching, especially at night, the doctor can prescribe the appropriate treatment, which should relieve symptoms within a few hours or days. In cases of secondary infection, antibiotics may be necessary. I hope this information has been useful. Share this video with your contacts and groups on WhatsApp. We will see you again soon. Bye.